Radar COVID, the great asset of the government of Pedro Sanchez to track coronavirus infections, is a complete failure. And it is not an appreciation. When it was announced, now a year ago in the island of La Gomera, the Ministry of Health said that the app was capable of detecting up to 6.4 risk contacts for each contagion. The result doubled the effectiveness of the trackers, doctors, nurses and the military who do telephone monitoring of infections. The published data by his own Ministry of Health, they reflect a different reality. In the last week, the application has notified 2,095 positives when, according to the health services of the autonomous communities, the number of new infected far exceeds 180,000. That is, 1%. If the epidemiological reports of July 22 and of the last week are compared with consolidated data, it is observed that the total number of cases of coronavirus has increased by about 200,000. A figure that, if the app Radar COVID, it would be reflected in it. But it's not like that. According to the website of the application itself, 2,095 codes have been entered in the last week. Or, what is the same, the location of a very low proportion of all new cases has been managed. The scarce implementation of this positive tracking platform is not something that was not intuited. According to the Ministry of Health itself, the penetration rate of Radar COVID is 18%. 7.5 million Spaniards have downloaded it since it was launched in August 2020. In the last week, in the middle of the fifth wave and with the infection spreading, only 23,984 people have downloaded the tool that, as they remember from the Ministry of Health, has interoperability with countries such as Germany, Ireland or Italy. But even achieving a massive installation of the tracking application is not a guarantee of success, and the United Kingdom is the closest example. The NHS COVID-19 application, the equivalent of the Spanish COVID radar, has been well received, being present on 1 in every 5 adult phones, according to official statistics. However, during the Eurocup, a survey by the consulting firm Savanta.com Res warned that a large proportion of young people between 18 and 34 years old, who were in the focus of transmission and contagions, deleted the application from their phone to avoid notifications constant. As infections increased in their environment, their smartphone kept warning about the protocol they should follow. Shortly after the presentation of Radar COVID in Society, the government sneaked in the magazine Nature a study that spoke of the success of the app at a time when it barely diagnosed 2% of infections. That qualifier of success was signed by a dozen authors linked to a large extent to the government of Spain and who declared that they had no conflict of interest in their assessment. In this same sense, the article clarified that the observational study had been funded by the Secretary of State for Digitalization and Artificial Intelligence, of the Ministry of Economy and Digital Transformation, that is to say, of the government.